I think historically, as an organisation, we'd shifted our focus for some time, driven by external landscape, so the health and social funding streams, health and social drivers, how focus had moved towards the stroke survivor and away from the family and carer.
I mean, carers are there with the people that have had stroke all the time, potentially, depending on the relationship of the carer and person that's had a stroke. And they are there for the long term. And the support that they provide people who have had a stroke is significant. And the support that they need, I think, is significantly underestimated.
OSCARSS stands for Organising Support for Carers of Stroke Survivors, and it's a research study that we carried out over the last few years. It's a big collaboration with the university academic people, but also with the Stroke Association and with carers and people who support carers.
Just involving carers or involving any sort of public participation in research, I think, is really got to be the way forward. It's, you know, I don't know how you could do research without doing that.
And they worked with us at every stage of the project, helping us develop it, deliver it, and understand what we'd found as well.
There is a certain satisfaction of being part of a wider team contributing to better services.
What's the experience of receiving support for those carers, and how do we better improve the kind of outcomes for carers, and how can we actually make that a better experience for them?
So the approach that we were looking to explore, it's called the Carer Support Needs Assessment Tool, or CESNAT. So when we talk about the CESNAT stroke approach, we sometimes simplify it in terms of these 4 pieces of a puzzle, from identifying a carer through to having a conversation about needs, and then tailoring support inputs to meet those needs, and then coming up with an action plan and steps to review those needs as they change over time. And that involves scripts, paper tools, but also just a fundamental ethos of carer-centeredness.
It was quite an eye-opener for me, really, just to be confronted with some of those questions that you get asked as a carer in terms of how are you feeling, how do you manage, all those difficult questions that you kind of put to one side because you just got on with it. And then you start kind of having a chance to reflect about the impact that it had on you. You realise how enormous it was, really. I suppose it sort of brought it home to me. I found it quite emotional just filling out the questionnaire and answering the questions, to be honest.
In OSCARSS, we carried out what's called a cluster randomised controlled trial. So we took 35 different stroke association services from all across England and Northern Ireland, and we randomly assigned them into 2 different groups. So one group was trained in the CESNAT for Stroke approach, and the other group carried on working as normal with carers.
During this study, we actually worked with 414 carers who took part as research participants. They came from all walks of life. I think the youngest carer was 21, the oldest carer 88. So a whole range of people who provide care for stroke survivors.
The information that helped us understand how this approach worked in practice and whether it was beneficial, we collected that through carers completing postal questionnaires about their strain, about the burden that they were experiencing, and their mood and things like that. And the sort of services that they were using, the healthcare services that they were using. We had information from the Stroke Association service delivery records as well to help us understand what was actually happening on the ground, how many support sessions were being delivered, and what sort of information was getting captured in those support sessions. We did interviews with carers as well over the phone to help us really get that rich understanding of what were your experiences of support within the Stroke Association, how has this made an impact on you. In addition to interviews, we carried out staff surveys and staff interviews as well, and that was to help us understand what's the staff experiences of learning this new approach, of delivering it in practice, of working with carers. In an ideal world, everything would be quite simple.
in a study, you offer a support for someone and you find that it's effective. But the reality that we've found out is that it's far more complex.
So one of the main questions that we have is, when we compare the CESNAP for Stroke approach to normal ways of working, does it reduce carers' self-reported strain, their burden, does it improve their mood? And the short answer is that we found that actually, no, it doesn't. The carers who received both these different ways of support actually report very similar levels of strain, burden, mood difficulties and so on. One of the key things that we showed here is that carers really valued the support that they got from the Stroke Association, regardless of whether it was CESNAP Stroke or standard practice or perhaps something in between. One of the other questions that we had in OSCARSS is, which approach is better value for money? And what we found is that the CESNAP Stroke actually cost a little bit more to deliver. And that's because carers were getting slightly more support sessions and they were accessing slightly more health services. So that kind of bumps up the costs. But we didn't see the health benefits. So we say that actually the approach is no better value for money. But looking at cost information is really tricky, and it may be that it costs more in the short term, but it might save money in the long term in ways that we haven't measured. So I think, you know, when we look at stuff like this, we have to be very careful how we interpret it.
What we learned from the carers is that actually the task, though, of helping a carer to identify their own needs, to put themselves first, that is actually quite challenging. And that is something that we really in the future need to help the staff to be able to work with the carer, to put themselves first, to be able to say what are my needs and that I have a right to be receiving some support as well.
I think there's a couple of things. The fact that there was no difference between the two groups I think is really interesting. I think personally it probably reflects the fact that the practice either wasn't implemented in the way that it was intended or was quite similar to the way in which many sites already work.
Of all the things that we found out, something that's really important is that we know what the barriers to implementing CESNAP Stroke are. We found out a lot of information about that, and that's very important because it means that it tells us how we might be able to actually try to do that in the future. And there's lots of very valuable lessons from the OSCARSS study about how an organisation needs to actually support their staff, the kind of skills, the kind of training that they need to really support the carers.
It's really been a value to us as an organisation, but it's also been it's enabled me to fulfil something that I hoped I would be able to do, which is actually test and learn about the approach we have to carers.
So yeah, it's a welcome focus in a busy environment that has very competing needs. So our staff, our coordinators are faced with all sorts of things that people need support with, and I think to bring this focus to the carers is really welcome.
It's about how we learn, how we potentially implement this, and the difference it can bring through not just using the tool, but actually inducting and training our staff.
It's been really great working with the other researchers. I think they've really been excellent, and I suppose, as I've said before, have really turned that sort of myth about sort of researchers being somehow divorced from their kind of the subject that they're looking at on its head, to be honest. You know, they really work very closely with Stroke Association and carers, and been able to encourage their involvement in a way that's been really nice. It's been really positive.
And I guess finally then, as a research community across the United Kingdom, across Europe, we need to come together, and we've already started plans to come together to really build on the work that's happening here and to be able to bring about some kind of large-scale improvements in outcomes for carers of stroke survivors.